Freedom Mini Dental Implants and Dr. Regan Ackerman joining us here today. We're going to go through some models, talk about some before and afters, a lot to cover, and it's great to see you again.
You too.
Let's, since it's been a bit since you've been on the show, let's do a little refresher, kind of talk about what you're able to provide for patients, what you specialize in.
Yeah, certainly. So I kind of specialize in, we call it a mini dental implant. So it's just a smaller diameter implant. That's the reason we say mini, because it's just a smaller diameter implant, which makes it a lot less invasive and less healing time, and usually less costly than the bigger surgical implants. So a lot of people that maybe were told they weren't a candidate for maybe the bigger surgical implants could still be a candidate for the mini dental implant, because I don't have to have as much bone to place an implant. So a lot of people, you know, maybe lost their teeth because of periodontal disease or bone loss, or were told they needed a bone graft or sinus lift, and you know, either couldn't afford that process or didn't want to go through that process. So with the mini dental implant, it's just a lot less invasive, and you could be a candidate when you were maybe told you weren't a candidate before.
I think this is a perfect time to bring in some of the models, because when it comes to mini dental implants, there's a lot of different ways that you're able to help people with permanent teeth.
Yeah.
There's some that maybe you just lost one or two, and you've got the models to show it all.
Definitely. So I'll kind of start with the snap-in denture, because that's definitely kind of probably one of the most common things I do. So many people struggle with their dentures. So they're either using gobs of denture glue to keep their denture in, or they're not wearing their denture at all because it won't stay in. So with the snap-in denture, so these are the mini dental implants. So when I place these, I will, you know, numb you up, just local anesthetic. I don't have to sedate you, put you to sleep. I'm not making any incisions or stitches. Kind of make a little hole, you know, through the gum into the bone, place the mini implants. The great thing about the mini implants, they don't have to heal another 3 to 6 months before you can use them, like the bigger surgical implants. The same day I put these implants in, I will put these attachments inside your denture. And then that day, you get to leave with your denture snapped on to those implants. So no more denture glue anymore, no more floppy denture. You get to eat better. You can eat steak again. And a lot of times too, people are struggling with the upper one. So a lot of times if they're a candidate, I can trim back this off the roof of their mouth so that they don't gag anymore and they can taste their food again. So that's a big advantage of having implants in the mini implant, where you can, you know, leave with your denture snapped in the same day I place the implants.
Okay, that's obviously an option that a lot of folks need. There's some other areas that you're able to help as well.
Yeah, definitely. So I'll kind of transition to the nicer option from the snap-in denture, is what we call the permanent teeth. So this is great because you get rid of the denture completely. So, you know, no more denture, nothing on the roof of your mouth. It's mainly just the teeth. And same process as far as placing the implants, no incisions, no stitches, you know, just place more implants. But then this option, it's not a denture, so it's a much stronger material. It's what we call a bridge, and it gets cemented permanently onto those implants. So it's the closest thing to getting your natural teeth back. And then you have nothing on the roof of your mouth anymore. It just feels more like your natural teeth, and no denture, no glue. You can eat steak, eat whatever you want again.
The third model here is kind of maybe a hybrid, depending on what you've had happen, maybe an accident or a sports injury.
Right. So not everybody's missing, you know, all their teeth. Like you said, maybe they're just missing 1 or 2 teeth. So, you know, we've talked a lot about replacing, you know, a whole mouth of teeth. But if you're just missing 1 tooth, it's like you said, a sports injury or a car accident, I can do a single tooth with the mini dental implant. And usually, you know, there's lots of prices out there, but usually the mini dental implant can be about 1/3 to half the cost of a surgical implant. And when I place, you know, same thing, no incisions, no stitches, and then I'm able to, you know, replace just that single tooth, and it gets cemented on. Or same thing, if a lot of people are missing some molar teeth in the back and they don't have anything to chew with anymore, can replace 1 or 2 or 3 teeth, get rid of a partial. If you have one, you know what it is, because you probably hate it, so we can get rid of that. So it all depends on the situation. And we offer a free consultation. So people, make the appointment for the consultation. It's no charge. It includes a 3D x-ray to make sure they've got enough bone and they're a candidate, for the mini implants.
There's a couple minutes left. I want to make sure that we have time to show at least a few of these before and afters, because every time you bring these, it's always so profound to see the afters and the smiles on the faces of your patients.
Yes.
It's like a major aspect of their life that's now back.
Yeah, this is Jamie right here, an amazing person, amazing patient. Came in, her teeth were failing her. She knew she needed her teeth taken out, and we were able to do the permanent, mini implant bridge for her. And talk about life-changing. I mean, look at that smile.
Beautiful.
And just the confidence that she has now, and she didn't have to have dentures, long term. She can taste her food and has the permanent teeth.
I think too, as we move to the second one here, a lot of people love this option too because of you mentioned not one of these major surgical procedures where the recovery time is a whole nother thing you have to budget for in your life.
Right. So yeah, I'm not making any incisions or stitches when I place these implants. I don't have to put you to sleep. A lot of people have, medical history issues, and most of the time I don't have to change anything with your medications or anything. So yeah, just looking at these pictures, it makes me smile because I know all of their stories and all of, how it changed their life, and able to smile again and have confidence again, and, chew again, eat what they want. It seems like steak and salads are the two most people miss the
Two
most.
things sometimes often eaten together.
Yes.
Okay, well, if you are out there and you want that confidence back and you're seeing this and say, man, that after picture is what I'm after in my life, let's talk about the best way to get in touch with you and get rolling on the consultation.
Yeah, certainly. So we have a website, freedomimplants.com, or you can call the office at 502-937-4930. Like I said, the consultation is no charge. We are a small office, not corporate. I'm the only dentist there, so your consultation will be with me, and you will know who you are if you become a patient. You become family to us because, like I said, we're small, we're not corporate.
It's a beautiful space. It's a comfortable space. I've been there before, and I know that you do a lot of important work changing people's lives. So it's good to see you again, and hope to see you again soon.
Thank you.
All right, stay with us here on Wave Listens Live. One more great segment to go, talking about some shocking retirement stats. You've got to hear these. Marcus Warren's here. Warren Wealth Management and Tax Planning after the break.